And here's the biggie. It's called the FTEU, free to end user. Now, most of the world, as you probably know, works on a calling party pace. In the US, it's split in half, both for voice and text messaging. So the other day I walked into T-Mobile to get another phone for one of my kids, and as I looked at the phones, I'm like, about I think 80% of the phones required you to, a data plan was mandatory. So not only are you locking me into a 2-year contract, but now I'm paying an extra $25 for this data plan. So I was like, well, no wonder Metro PCS is doing so well, which is basically for $50, no commitment, it's all you can eat. What I'm getting at is that I think if the carriers continue, basically blackmailing us with these plans, more of us are going to be switching to the Metro PCSs and the Boosts of this world, which basically don't require a commitment, which means they'll be prepaid, which means there are going to be times when you're going to be running out of credit and you won't be receiving any text messages. Well, if you're a sponsor and you want to make sure your target audience gets a text message, if you set it up as a free-to-end user, even if they don't have a text message plan or they run out of credit, they'll still receive the text message. So this is another benefit, that you can't do with apps that are all data-based. So, as I think about, as I talk to a lot of people, and there's a lot of philosophical discussion sometimes amongst kind of us entrepreneurs, how is this going to work? And then you talk to investors and analysts. I just want to share one thought with you in terms of what I think is going to be a big part of, whether mobile health is going to be successful and how. So when I kind of entered into this endeavor, I kind of asked myself 4 questions. The first one is the need there? Is it big enough? And we all know what the answer to this question is. It's yes. The second one is, does it work? From a clinical standpoint, is it efficacious? We have data and some other people have data that says it yes. From a technology standpoint, it is scalable and stable. The next question and next 2 questions is kind of, in my mind, the chicken and the egg. So will people use it? And I'll explain what that means. And will somebody pay for it? So I believe that, most of you here probably get a coffee every day at Dunkin' Donuts or Starbucks and pay $4 or something like that, which is over $100 a month. But asking most of you to pay $5 a month for a service like this is just too expensive. For whatever reason, we are conditioned to believe that somebody else should be paying for it. So if I'm a pharma brand manager, if I'm a health insurance company, if I'm somebody who has to pay for this, my question is like, well, show me the data. For me to see the data, somebody's got to press the button, right? A patient's got to press the button. So how do we get them to do that? So that's kind of one of the next challenges that we at CareSpeak are trying to solve. We're working with a phone company, which basically we're going to be testing what I call the carrot and the stick model, where your phone is going to be working based on your compliance reporting. So if you are a 15-year-old kid with a chronic condition and you're supposed to take your meds twice a day, if you don't report your meds and confirm today, your phone is going to be switched off tomorrow, except for that 911 number, maybe mom's and dad's speed dial, and a text message channel to us. The minute you start confirming again, we'll switch it back on automatic. Of course, you'll have, you can't wait until midnight, a minute to midnight, and do all your confirmations. There'll be a time window when you can do this. So, these are and there's some other things in the copay card system that we're looking at. So I think there's quite a few innovative companies that are looking into this incentives to change behavior, not in mobile, but in just health in general, using game theory. And we are working also now with a university on the East Coast and looking, into rewards for behavior change and doing some clinical studies there. So, in conclusion, I just want to kind of recap. CareSpeak is basically, a very effective tool. It works. We have the data to show it. It really fits everyday behavior, which I think is key. It's intuitive to use, it's simple and affordable, and most importantly, it's scalable. So I want to leave you kind of with 2 slides. This is a part of an email I got from a mom about 7 months ago. She heard of the Mount Sinai study, wasn't part of it, and asked me if she, if she could purchase this, and we just obviously signed her up for free. And this is the email I got about a month ago. So, for you entrepreneurs here, the roller coaster we go through and the ups and downs. And I think that these type of things make a big difference in what we do. And kind of the key takeaway I'd like you to think about as I wrap up is, simple is good. An adherence solution doesn't have to be complex, sophisticated, or expensive to be effective. Right. Thank you.
Thank you, Serge. We're running a little late on time, so Okay, so you just give me the sign when, okay, all right. So, so I want to thank both of you, and I mentioned that we'd hear a little bit more about simplicity, and Ralph Waldo Emerson was at Walden for years and years before he came up with simplify, simplify, simplify. So you've really come up with that very much quicker. I'm interested in that. But I do have a couple of questions, and then I'm going to open it up for audience questions. So first of all, Jeff, let me ask you, what do you think in terms of the No More Clipboard? What contributed? What could you list? Just a few items, real quickly, contributing to the success thus far.
Well, if I look at what we're doing in Washington, D.C., I think it's a couple of things. One, to build on what Serge just said, it's all about simplicity. Keeping it very simple and very focused on a handful of things that are needed to improve diabetes compliance has been key to the success there. And part of that simplicity, too, is, again, that this doesn't have to be a special phone that has special features on it. It is any web-enabled phone, any carrier, which is something that the patients appreciate. So instead of automatically kicking out a huge percentage of patients who say, well, I've already got a phone and I don't want to get rid of it to get something else, you say, no, you can use the phone you already have. That automatically improves the membership in the program. Also, incentives are important. So giving the patient an incentive to participate, not again covering everything, but kind of they have some skin in the game, but they're also getting some positive reinforcement. They're getting part of this part of their voice and data plan paid for participation, but also, as we learn, giving incentives to the clinicians as well, and even if it's in the form of cupcakes, which ultimately doesn't contribute to diabetic compliance, if it gets them to participate, so much the better. And finally, I think for us, it's all about making sure that you're providing value to both the consumer and the clinician. It can't be weighted too far to either party. You got to make sure that both parties are deriving value.
So, Serge, I'm wondering if you could comment on that too. You've had a lot of success with the text messaging. Are you looking at other platforms? And also get a little bit into this incentives. You mentioned for patients, but I'm wondering for clinicians what you've got up your sleeve.
Yeah, so in terms of technology evolutions, the way we think about text messaging, it's a data transfer protocol and it's a user interface, right? So right now, for us, it's all about scalability, affordability, and accessibility. And the reality is, text messaging is the only thing that works on every phone and any carrier. Okay, that's the bottom line. So looking forward, we're looking to integrate, kind of substitute the UI piece with some more user-friendly application. For example, what Wendy's team did for today's the web page app was brilliant. I thought it was really simple and good. So those are the type of executions that we need to offer consumers. In terms of incentives for clinicians, what I'm really finding, clinicians are motivated by doing clinical work. And if you can help them be successful in generating data and publishing those results, that's what their life is about. And you have to help them be successful. And it's really a long-term partnership. And I'll just caution that entrepreneurs work on a very different timeline than clinicians. So, we have to be very patient with them and really help them also navigate their system, because they work in a very bureaucratic environment. So while they might be very entrepreneurial, they have their obstacles internally. So, patience is key in making that happen.
So, Jeff, I want to come back to this idea of the clinician and their mindset. And you mentioned that your partners, your clinical partners, anticipate doing a publication, preparing data for publication in the near future. But I wasn't clear there. Are they running a clinical trial? Do they have a randomized control trial? Is there a control arm that's not using the system, or how are they going to report the data?
Yeah, there is, and in fact, they even have another arm where they're using another mobile